Welcome to a special show, how Marion County responds to disasters and prepares to respond to disasters. Today, we'll hear comments from Lloyd White, Chris McIntire, Jamie Moore, and Carolyn Ledsome, and visits to the 911 call center, the election center, and to the health department. Here on Marion County TV 19, a public service PEG access, Time Warner, Greater Fairmont, Council of Churches. Supported by the Council of Churches and love gifts from people like you. Assisted by grants from our legislators, both in the Senate and the House, and supported by the city and the Marion County Commission. We're 24 hours on the web at gfcc.peg.tv. And we have a blog spot that gives us all of our monthly listings. You can visit us at Facebook on TV 19 Fairmont, and visit us at the J. Harper Meredith Building, room 102. For our schedule, email us at mrc@iolinc.net or call us at 366-4511. Let's get started. So tell us, what is the process? Where does it begin? Where does the health department enter?
Well, I think it really depends on the type of disaster, whether it's a communicable disease outbreak, flood. It really depends on the type of disaster as to what entity really takes a lead role. I will tell you, in Marion County, we are blessed to have, and I've said this multiple times, I think Marion County is best prepared as any county in the state to respond to any type of disaster, whether it's a public health disaster, whether it's a natural flood, man-made disaster, whatever that may be. And I got to say this because we have in this room, we have two of the best folks in the state in those categories to assist. And Chris McIntire is probably the best OES director in the state, and Jamie Moore, the very best public health emergency planner in the state. So I think having skilled folks that know what they're doing, that have really compassion and passion for what they're doing and the services provided, really sets us apart from any county in the state of West Virginia.
What are some of the types of disasters that you would take the lead on?
Well, probably foremost any kind of a public health disaster, communicable disease outbreak, and those type things. If you go back to H1N1, we were the lead agency in terms of prophylacting individuals against the H1N1 virus, and much like the flu virus. So any type of it's a public health emergency disaster, we would be the lead agency in terms of that.
What do you do when a disaster occurs? How do you begin to get the word out? What are some of your key resources and ways in which you get the word out?
We have effective communication plans in place, and we exercise our plans, and along that goes with a volunteer database and West Virginia Ready software packages that's provided by the state to facilitate that.
Okay. How many problems have you taken the lead on, let's say, within the last 5 years or since you've been here? What are some of the things that you can specifically recall that you have really made an impact on and shared the word around?
Well, again, we were fortunate in our county not to have had many. Our whole plans are based on planning and preparation in the event that something does happen. I think it goes back to the biggest one we had here was the H1N1, where we did prophylaxis to the general population. It's the biggest one I can think of.
And how do you work with other agencies? For example, we have Chris McIntire here. What is your role when something happens that 911 takes the lead in? Where do you fit in?
Well, again, it really depends on the type of disaster. I can tell you back a few years ago, Chris and I, along with the county commissioner, had delivered water to areas that didn't have any water. So it really depends on the disaster, what type of response it is, whether we would be the lead agency or OES would be the lead agency. However, it doesn't matter who the lead agency is, again, because of familiarity with each other and the working relationship that we have, it worked extremely well. So whether it's a lead role or assistant role, we just do what we need to do to get the job done.
The importance of the health department is being seen here in Marion County because in a few weeks you're going to be dedicating this building. Tell us a little bit about the expanded services that will be helped and the type of improvements that this building will see.
Well, when it's all said and done, we will have total project costs about $1.752 million. We took an old building and just totally renovated it, new HVAC system, new heating, new plumbing, new electricity. Everything is brand new. Now, we did that in order to facilitate the programs here and the clients that utilize our services. we hope in the future to expand those services to be able to be a healthcare provider for the unmet needs of the general population in our county.
What are some of the needs that are met now that people come here for, that you see people on a daily basis?
Well, one of the biggest programs we have is a family planning clinic. We also have a very good immunization clinic. We have STD clinics and those type clinics that served by a population that needs those services that we try to provide for them.
I notice people flow in and out on a regular, consistent basis. What are some of the unmet needs? You mentioned that part of the hope is that you'll continue to meet not only the needs that are here, but even begin to meet some of the unmet needs that now you can do with the new building. What are perhaps some of the unmet needs that maybe this building will be able to foster and be able to assist with the populace of Marion County?
One of the things we would like to do, of course, public health is all about prevention. So one of the things we would like to do is have some preventative programs in place, diabetes education, diabetes training, hypertension clinics, and those kind of things that will empower people to take control of their own lives.
Why is health such an important problem? I mean, it seems to me like we have all of the necessary tools to be healthy, and yet we're an unhealthy nation, we're an unhealthy state, we're an unhealthy county. What is that?
It comes down to personal behavior. Just because we know what to do doesn't mean we always do it. And I'm sure that the population knows what to do. They know the importance of obesity and maintaining a quality weight. They know the importance of having blood pressure under control. I think they know those, but taking the steps to change behavior is one of the obstacles that faces to, it's a barrier to healthcare.
Okay. Another quick question. Tell us about the staff you have here.
I am absolutely thrilled to say we've got the best staff of any health department in the state of West Virginia in terms of quality folks who have, in my opinion, what's critically important in the healthcare industry is the compassion and the passion to serve the needs of the population that we have. We've got a phenomenal nurse director who is really, in terms of looking out for the needs of the general population, is looking to expand our programs to, again, what needs are out there that we can assist with, and then her staff is great staff, really good staff.
Public health emergency programs are the grant that is provided by the CDC and Homeland Security to help health departments prepare and respond to disasters that evolve around public health, and those normally are biological, chemical, nuclear, radiological events that are man-made or naturally occurring.
How long have you been in this position with this title?
I've been at the Marion County Health Department for 5 years, and then 3 years previous to that I was at the Montague County Health Department. And a couple years prior to that I was a sanitarian.
Now, have you had to implement some of your emergency disaster work in these areas?
We have throughout the years implemented components of plans or full plans on numerous occasions. One of the first large-scale events that we participated in was the Hurricane Katrina response, which at that time I was working in another county, in Montague County, and I became the regional coordinator for our 6-county region, and actually during that event. And this county participated with personnel at the event up at Camp Dawson.
Okay, the resettling of the survivors.
It was about a 30-day response.
Yes.
And then, as Lloyd mentioned, we had responded to the H1N1 outbreak and of the pandemic flu. And we're able to coordinate with about 23 different partners in the community to vaccinate roughly 12,000 people in the county.
Wow. What does it take to be declared an emergency?
Public health emergency declarations normally come down from the federal level. So it's a presidential directive that declares a public health emergency on a national level, as the H1N1 response was. They also can be declared locally through the governor's office.
What happens when the disaster is over? What's your role then? Is it to monitor?
Well, part of our emergency response, and something that we do on a routine basis, is disease surveillance, and that would be a major role in the aftermath of any event, is to continue to do the surveillance in order to get the appropriate information into the system, the state system, the federal system, that allows us to track and monitor the disease, if it was based around a disease, if it was a radiological event, radiation levels, and to make sure that all that data is gotten to the appropriate person, and then we're able to get good information back to make good decisions from. Any public health emergency is not done in a vacuum at the Marion County Health Department. We're always reaching out to other partners. For instance, during the H1N1 clinic, we had 23 different partners. We partnered with the school system, who conducted clinics with their school nurses. We had private providers who were also providing vaccine. And we partnered with emergency management and operated mobile clinics out in the community, which was a nationally recognized best practice. In any event that we do, is never done in a vacuum. We're always communicating up through the system, with OEM, with Chris McIntire, with that group, keeping the lines of communication open, and to build the best response we can.
One final question that I have, maybe you guys need to chime in, but are you anticipating any other kinds of needs, emergencies, problems through the rest of the fall and the winter of 2012? Do you foresee, is anything being anticipated that you're going to have to respond to, or that you're gearing up, other than the just overall supervision of health needs?
Currently, activities that are on our radar, we are working more with West Nile complaints, and trying to mitigate that problem, which is, it comes from mosquitoes, and mosquitoes come from or breed in little pools of water. So one of the things that we're doing is trying to educate folks that if they can get rid of the pools of water, or treat the larger stagnant pools of water to kill the mosquitoes, we can eliminate the possibility of West Nile. It is on the rise throughout the country. Primarily, you're hearing a lot about Texas, but surveillance has told us that West Nile for this season is more prevalent even here in West Virginia.
I heard a report that Randolph County may have experienced a couple of incidences. Is there any incidences that you know of that's been specifically reported in West Virginia so far?
Currently, we have one confirmed case in the Huntington area.
Okay.
It was 40-some, at last count, there was 40-some deaths in Oklahoma and
Texas
as a result of the West Nile virus.
So there's been fatalities in other states, Texas, Oklahoma. Current surveillance, the last numbers that we got for the state of West Virginia was about 41% of the mosquito colonies tested were harboring some West Nile. So that's increased.
One final question. I know a couple of years ago on the radar was Lyme's disease. That seemed to have had some instances. In fact, one of my church members had contacted Lyme's disease. Haven't heard much about it. Is it under arrest now, or is it just kind of fading away? Or
Lyme disease is considered endemic in our area, which when we consider something endemic, that means that it's just prevalent in our environment. So you must always take precautions against exposure. Lyme's disease is the reservoir for Lyme disease is deer. All right, and the mode of transmission is a tick. So if you are bitten by a tick that has Lyme disease that got it from a deer, then you're have the possibility of catching Lyme disease. So it's something you always need to take precautions about, and it's something that is endemic. And in years like this year, that are moist, we've got a lot of water, we got a lot of bugs. If there's more bugs, there's more potential to catch Lyme disease. Of course, there's more ticks.
Mild winter last winter too.
Yeah.
If you're interested in us providing some informational services on the Marion County Health Department, you can contact the Marion County Health Department at 304-366-3360. And depending on what information you are asking about or asking for, you will be directed to the appropriate individual, and then we can set up some type of informational type activity.
Well, I'm the Deputy Director of 911. Carolyn Ledsome is the actual 911 Director. In my 911 role, I have to coordinate all the communications in the county to ensure that we have radio communications, internet communications, and phone communication with all the first responders and also with all the citizens of Marion County.
How do you do that? How do you make sure that you are in communications with all of the first responders?
Well, our radio network has systems monitored, is monitored through Motorola in Schaumburg, Illinois, and we also have paging devices that when we have an issue with the radio system, we'll get a page and tells us what system is having a problem, and it'll dispatch a technician to the issue.
How many agencies do you work with when a disaster occurs, whether it's a flooding or a health need or basically a storm that knocks out emergency services for people?
Well, what we do, we have an emergency operations center located at the 911 Center on Pleasant Valley Road. At that location, we have department heads from all the agencies that are involved in a disaster. They'll meet at that facility. We, at that point, make all the decisions for the disaster on what to do, what steps we need to do in planning, what responses we need to have, and what resources we need to get out to the public.
Are you the one that makes recommendations to the state or to the federal level for additional assistance or grants or declarations of disasters?
Well, what has to happen if there's a disaster in our county, we have to declare it locally through the county commission. Okay. We send that information up to the governor's office, and all that information is funneled through a computer system called E-Team. And any request we have for assistance has to be put in the computer system, and it has to come through the emergency management office in Marion County to the governor's office. That eliminates the duplication of resources and just people off the street or like a town calling for a generator, and then I order one. Now that we have two of them sent to the same location, it kind of streamlines the process.
Absolutely. What's your task in monitoring the situation? Once an area has been declared a disaster situation, how do you go about monitoring?
Well, whenever we have a disaster, we automatically dispatch 3 teams of personnel out. The health department guys work with us, the assessor's office works with us, the county planner, the maintenance staff. We send people out and do damage assessments, and we try to get the information back to see how bad the situation actually is. That'll stimulate either we declare a disaster or not. And once that happens, we meet in the Emergency Operations Center, compile all of our data, and then we keep sending our teams out in the field to check the status of what we need to do for the citizens.
When you say send your team out in the field, what kind of team are you talking about?
Well, you don't have enough people to do every task that you need to do. We use the health department people to go out and help us. If I need information from a certain part of the county, I need to know how bad the damage is, I'll send those folks out. We'll use the people from the fire departments, the sheriff's office. Last year we had the DE people going out during the flood. They were sending us pictures back of this road and how bad things were. The DOH supervisor works with us because we can't have people in every corner of the county, but we have folks from other agencies that can give us the data that we need to make our decisions with.
That's good. Do you also have a chance then to meet when there is not a disaster?
We have a group called the Local Emergency Planning Committee. We meet once a month at the 911 Center on Pleasant Valley Road, and we discuss all the planning needs, and we critique the disasters that we had and do after-action reports. And that group also comes up with the disaster exercises that we have in the county each year, and they coordinate the exercises.
Give us a clue as to some of the services, some of the disasters that you have been involved in recent years. I know there's been 2 recently this year, but what are some of the things that people of Marion County might be aware of that you have kind of taken the lead in?
Well, we're very fortunate to have a emergency management office that has supplies. We had a disaster, the snowstorm back in 2008, and we needed cots and blankets. The closest cots and blankets that we had were in believe it was Parkersburg at that time. And the snow was so deep we couldn't get to Parkersburg. So we were kind of left out in the cold, and we said, you know, we're going to change things around here and start doing things on our own. We started getting some grant money in. We started getting partners from the health department with some of their equipment, with the Fairmont General Hospitals teamed up with equipment. And now that we have a stockpile that we have at our election center, you know, we have the capability of providing 780 cots for the public. If we need to shelter people, we have sheltering kits. We have about 48,000, I think it is, N95 masks. We have MREs. We have bottled water. We have portable generators to make sure that emergency service people are taken care of, where we can keep the fire stations and the EMS stations open. So, you know, it's something to see, and we'd like to show off some of the equipment and supplies that we do have, but we're very fortunate to have this. And then the past two disasters, the surrounding counties, it was one of the first phone calls they made was to Marion County to say, hey, we need some supplies, and we were happy to give them and happy to have them.
When we had the H1N1, you know, we were thinking, what can we do to reach most of the population in our county? We have still yet a rural county, and there's a lot of folk out in some of the outlying areas that don't have the ability to get to town for whatever reason. There are still a lot of barriers to health care. So we thought, well, how can we best provide that service? So when I contacted Chris, I said, Chris, you know, can we do a mobile clinic? And so obviously he agreed immediately, and so with the help of the county commission and Chris, we established mobile clinics in 3 sites in our county, and we gave several H1N1 shots to those folks who assumingly probably wouldn't have gotten them because there were transportation barriers. So taking the services to the outlying areas when there's a need or disaster, I think that's what sets our county apart from other counties. We were the first county to do that, and then once we did it, then other counties said, well, it's probably not a bad idea. So, you know, again, it's the working relationship, the camaraderie that we have with all entities, which makes our county, again, I've got to say this, I think we are better prepared than most counties, if not all counties, in West Virginia. I'm really pleased with where we're at in terms of our planning and preparation.
Right now, this is our mobile unit that we have for chemical spills and oil spills, and we frequently take these out like to the interstate when we have a truck wreck or a tanker wreck, and it gives us the capability of providing the supplies to the fire departments to use in the event of some type of a fuel spill.
Tell me what is in one of the spill kits and what is this large
What we have
container?
in here is absorbent booms. These can be stretched across land or water. They link together and they absorb oil or petroleum-based products that you can absorb with it. We also have some of the spill kits. We can absorb acids and some different type materials. And then we have pads and different types of different pads in here to absorb like antifreeze and different types of coolants and things of that nature.
Wow. Have you used this in recent years?
This unit probably gets used, I would say, once a month or once every 2 months.
Really?
Yeah, that's how frequently we take it out. Then the second unit we have here is a mobile sheltering unit. And this is in partnership with the health department also. Some of the supplies in here are their supplies also. We share supplies back and forth, the resources. And we have the ability to shelter 60 people with this unit. We can just deploy it, take it out to our shelter locations and set it up, and it comes complete with everything we need for a shelter, cots, blankets, pillows, and we have everything to even serve food with. We have containers, coolers, and things of that nature.
All self-contained in this unit?
All in one unit, yes.
And so, Lloyd, this is a joint venture with the health department as well.
It is. It is in terms of the supplies and what it takes to respond, shelter in place.
We have regular cots, and we also have 50 special needs cots to set up a special needs shelter.
Wow. When was the last time you employed this? Do you recall? Or
We've never used it in terms of utilizing the special needs section of the sheltering.
We just recently got that capability within the last year.
But this trailer was dispatched and sent to Harrison County during the windstorm.
Oh, yeah.
And they had it up there, and they actually set up a shelter out of it and used it during the storm. And our last unit we have over here is the emergency mobile command center, and this gives us the ability, if we have a large-scale incident, to arrive on scene of an incident, set up a mobile command post, and we can do all of our operations out of the mobile command center.
That is impressive.
This is our disaster supply center that we have for Marion County. We currently have about 780 cots. We have MREs, we have N95 masks for like the bird flu mask. We have emergency backup generators for emergency providers. We have MREs. We have mobile pods that can set up, mobile units that can set up sheltering for the individuals. We have bottled water here. We have chainsaws and things of that nature we got through working with Homeland Security grant money. And right now we're pretty well supplied, and we're also always looking for supplies and donations from people if anybody has any equipment. In the last flood and windstorm, we had Fairmont Supply donate a bunch of material to us, and it was very beneficial to the public. They had raincoats and things of that nature, gloves where they could go out and do some work on homes and stuff with it, and it was very beneficial to us.
You said when you started in 06?
Yeah, 06, we did not have any capability to provide any assistance to people other than what the state would provide. And with a great partnership with our other agencies and a very good county commission, if it wasn't for the county commission supporting us the way they do, we wouldn't have a disaster supply center like we have. And secondly, the county maintenance staff is wonderful. They coordinate these supplies for us. They get them out to in the field for us. And if it wasn't for those guys, we wouldn't be in the place we are today.
And thank goodness you have such a nice multi-purpose building like the old Bower Lumber, which serves not only as the election center, but now I understand as the emergency resource center.
Yes. I mean, we have so much supplies now that we have to have a forklift to unload things, and we go through so much water a year with water line breaks and things of that nature, giving out bottled water, that we have to have machines to move the supplies around. The Red Cross is partners with us along with other agencies, and we keep some supplies here in our county from the Red Cross for disaster cleanup kits so we can get them out in the field as soon as possible.
All right, Chris, we're looking at some sandbags.
Well, we have sandbags for flooding needs that we have. We carry sandbags here, and the devices that actually fill the bags are a plastic device that holds the bottom of the bag, and you can load the sand into it. We keep that in here as some of our supplies if needed during flooding. We do have MREs here, and they have a shelf life on them. And our food is monitored by the health department. They come over and check our inventories and make sure that we have things that we're doing that is safe for the public. And Jamie has an example of some of the MREs that we hand out if needed in the county.
What's contained in the MREs?
Jamie, can you tell us what's in the pack of them?
It appears to be there's a variety of MREs. This one is pasta with garden vegetables and tomato sauce. It's got some M&M's candy in it. Comes with a spoon. Meal's ready to eat. And a juice pouch.
Are there different types of MREs?
Yeah, we have 6 different varieties in that packet that we have in those. And then also here that we have our sheltering pods that we have. These are set up for 14 cots, blankets, pillows, and these come in a pod like this. We've assembled these together with our staff and the health department maintenance staff. And if we have a need to send one of these to a fire station or a shelter, they load it in the truck with the forklift and deploy the pod of 14 to whatever location we need to send it to.
And that includes what, like a pillow or?
We have pillows, sheets, blankets, and the cot in each one of those packets.
And you said how many do you have available that could be set up?
We have a total of 780 cots. Then we have 50 special need cots above and beyond the 780 cots.
Okay. And you keep all this here?
Yes, it's all located here. The county commission is working on a project now to build us a building up near the 911 center to house all the disaster supplies in, because we're growing steadily, and we know that disasters will never go away, so it'd be a very good asset for us to have.
Combination pods from Fairmont General are 2 25-bed mobile care sites. They come with all of the materials, cots, that the hospital would need to set up off-site in order to provide health care.
We keep bottled water stocked at the disaster center also. Typically we carry the gallon jugs of water, but this time we had a shipment in from FEMA with the small bottles. But the gallon jugs that we get, our supplier is United Dairy, and they're very, very helpful with us during disaster, bringing us water in when we need it to ship it to these towns that need water during a water line break or an actual disaster.
Lots of water.
Yeah, but I think that the general public doesn't have any idea what capabilities the county has, and a lot of counties in West Virginia is not as fortunate as we are to have this type of material in their counties to give out during a disaster. And I think we're blessed to have this kind of equipment and this kind of great working group together to hand out these supplies in the time of need.
Is the giving out of water a big issue, a big item that you do a lot of?
Yes, in the peak of giving out water, when Fairmont had the water crisis at the water plant, we gave out 26,000 gallons of water during that incident. But every year we probably go through, I would say, 4,000 to 5,000 gallons of water that we go through.
And this is all for drinking water?
This is all drinking water, yes. We have, also other equipment that we have in these pods. We have portable restrooms that we can deploy out in times of need. We have coolers we can put drinks in or supplies in. So we have a pretty wide range of equipment that we're very fortunate to have.
Wow. And do you also take the water out to different areas, like if Fairview or
Yes.
Manning?
Whenever we have a water issue, our maintenance staff is great. They'll take the order. It'll come in our office. We'll give them the order. They'll take it to whatever community they need to take it to.
Masks here are used by people in the field, surgical masks. Lloyd, tell us a little bit about what's inside of the Mobile Command Emergency Center.
Well, it's a fully functional, 100% self-contained unit. We have generators that mount on the back of it, so if we're out in an area that we need electricity, we can provide electricity. Inside, it allows for folks to meet Mobile Command Center if you have a command group set up. If you have each individual representing certain entities, we can set up and have meetings there and go over, and it's got a complete radio system so that we can have mobile communications from the trailer to any entity that's out in the field. So it's pretty impressive, pretty good unit to facilitate communications. As always, the best way to have effective communication is right at the scene, so this unit allows us to do that. I can tell you when they had that, what they call it, Dreco, that last one, Jamie and I were activated 10 minutes after 4 on a Saturday morning. Yeah. So we were out checking on nursing homes, making sure folks were okay. And I got a really nice card, beautiful card from Sister Stevens at St. Barbara's, because she's since passed.
Yeah.
I'd stop there on 10 o'clock on Sunday morning, just checking to make sure everything was okay. And she sent me a really wonderful card. And she told me, she said, you know what, I feel much better knowing that you guys are out here checking on us, and I don't feel like I'm on an island by ourselves. And so, of course, the county commission being the governing body of the county, they're responsible for 100% of things that goes on in the county. And the health department, we've just expanded our role probably over the last 10 years in terms of disaster preparedness, and to be able to set up mass immunization clinics. We have the capacity, and I forgot to mention this, we have the capacity to go anywhere and set up a mass immunization clinic right there on site. At 100% capacity with sheltering, with generators, with supplies. So if there's a segment of the population, I don't know, say that there's a disaster in another county, we need to go and set up and do tetanus, for example. We can actually go one site and set up and have mobile clinics right on site.
Wow.
Again, it's taking the needs to the citizens, just like this is what we used, a mobile command center when we did the H1N1. We took it to Metz, we took it to Joetown, and we took it to Worthington. Good response. We just set up shop. We were there, I think, each locations for a half a day. We just set up shop, and anybody that come by and needed an H1N1, they got an H1N1, and kind of a little bit scared me the morning we went to Metz because it was pouring snow down, the road starting to get slick, and Ben actually drove the truck and pulled the trailer. But it was great because we had heat, we run off with a generator, and it worked out good. And we can use that trailer. It just takes a phone call to Craig. Any point in time we want to do it, if we want to go just regular flu season and set up somewhere and do flu shots, they're more than willing to assist. And again, that's why I say our county, we've got some really quality folks who are working in the positions that they are.
Next, we visited the Marion County Central Communications 911 Homeland Security and Emergency Management and talked to Carolyn Ledsome, Joe Masturzo, and others relating to how Marion County responds during a disaster and during just a regular time of the day. You'll be surprised at all that happens.
Yes. Erie County has its own now. This is me. Let Joe.
911, do you have an emergency?
Oh, never mind. Don't let Joe answer it.
Hello?
It's me. Hang up.
Doris, go ahead and hang up.
Hang up, Doris. I said don't answer it.
I didn't hear you.
I don't know.
Whenever someone calls into 911, we get what's called an anti-alley screen. It's an informational screen that gives us the name, the address, the telephone number, the caller. And
Even if it's a cell phone?
well, if it's a cell phone, we don't get the name and address of the caller. We always have to make sure we ask, regardless of whether we get it or not. We always ask the name and address.
But we can do a phase 2 that gives us coordinates to
Yes.
where the person is, as close as we can get. We can't always get right on it.
And actually, with Carolyn's phone, we did get one, and we can type the coordinates into our mapping system. And I'll just show you real quick.
So you do everything one-handed. That's in case your left hand gets broken?
Yeah. And it hit as close as it could to where we are.
Okay. Is that the center?
It's not the center, but that's as close
That's
as
the
the
closest tower that it hits, so we
Yeah.
can get that close.
So it hit the tower across the one
No,
across the.
it would hit whatever the closest cell phone tower is. That
Yeah.
tower over there is ours. It's not a cell phone tower.
And it can do that all over the county?
But once it does that, then we import the data into a screen, into our CAD screen. Here's one with the name and address. It imports the data into for us. And this is just an extra patrol request, so it's not probably with
How
this.
often do you update your software?
Our map comes, what, every 2 years we get a new map?
Yeah,
Something like that?
county just did another flyover. I'm not sure when it's,
Screen to screen, you see how that's...
but
You
the
can
phone
set yours up.
company updates their information like weekly.
Once we import the data into the computer tells us who the closest stations are, closest fire departments, closest police agencies are, in order to send help.
How many
And that's another
callers?
screen.
How many operators do you have on?
We have
working at
approximately
any one time?
20 911 operators, and then administrative staff as well.
How many people work in the call center at one time?
Anywhere from 5 to
We
6.
try to keep at least 5 on. Today we only have 4. Joe, what do we average a day?
What's that?
How many phone calls we average a day? We did that.
Well, calls for service that we can, usually around 200. I don't know about actual phone calls.
Phone calls. I'm not sure. I'd have to ask Dennis back there. We answer all the sheriff's department lines. We have 3 of his lines. We answered 3 of the city police lines, Mannington Police.
So 200 that need a response. You
Yeah.
Need a car.
That's an average
An
day?
actual emergency that we send somebody out on, yeah.
Sometimes it could be more. Sometimes on afternoon shift alone, you may get 80, 90 calls for service in an 8-hour period. So it just depends on.
I'm surprised
I
how
would
busy
have
this
thought
county
maybe
is.
5 or
Oh,
something.
no,
No.
no. It's very busy here. We're one of the biggest counties around. It's surprising how many calls we
Is
get.
it having an elderly population increase that?
Like I said, we dispatch for all the law enforcement in the county. How many, I don't even know how
All the
many.
small town officers.
Very
full
common,
from all of them.
everybody.
We have the DNR after hours, we dispatch for them. State police, we give them every 30 emergency call that comes through. So we also call a power company, we call wreckers, we dispatch out those.
Somebody give me your address and put in there, he'll show
Yeah.
you your house.
10 Tiger Trail.
What is it?
10 Tiger Trail.
Tiger Trail.
It's easy.
We are getting better pictures. This one is old. When we're done, we'll be able to see all
It always
sides
shows
of
it
your
at
house.
the bottom of the hill according to MapQuest.
So this is better than MapQuest?
Well, I like to think it is.
that
The
looks-
county just did another
Right there?
flyover. I don't
That looks
believe
better.
it.
Looks a lot better than Google.
Yep. Sherry's house is next door. That's us. Yep.
So you could tell if I got my
Sheriff's Department.
yard cleaned up or not, huh?
It's not live.
I'm sorry,
Only if
what?
it was dirty that day.
Well,
What's your
people-
name?
Can you get an angle view?
Okay, what's your name, sir? What's your name? All right, I'll let him know you're out there.
What's his name? What's your first
I'll let him know you're outside, Mr. Villers. Thank you. Bye-bye.
All right, how long ago was this?
Can you learn to the house?
It was the
Marion
name.
County Unit on Station.
What's his name?
32, there's a Mr. Villers outside to speak to a deputy. He was told to come in.
White no.
Okay, I'm sorry. What?
In Lawrence Shore House. Right now, we only have one view, but we are going to eventually be able to see every side of your house. We'll be able to turn it.
When you get that name, call me back.
We have some of them, but we don't have them
Leaves
all.
are off the trees.
The leaves are off the trees and my husband's not home. Just saying.
This is probably 2 years old, you're saying.
I have people work 3 days and just get up and say, I can't do this no more. And then I have Joe's been here 10. Some stay, some don't.
Some can
You
roll
have
with
to
the
really like it.
punches. You can roll with the
Because he has
punches.
too much fun with the computer, so.
You
Things
have
are
to
out from
really
screen to
like it
screen.
to stay
He
here.
gets to
I
play
truly
with the
enjoy
tech.
my job.
Okay, what's your
Enjoy it
first
very
name?
much.
Well, you've been watching how Marion County responds to disasters and prepares to respond to disasters. You'll hear comments from Lloyd White, Chris McIntire, Jamie Moore, and Carolyn Ledsome. And visits to the 911 call center, the election center, the old Bauer building, and the health department. All today on Marion County TV 19, the public affairs program of PEG Access, Time Warner, and the Council of Churches. Supported by the Greater Fairmont Council of Churches and love gifts from people like you. Assisted in grants by our legislators. And supported by the City of Fairmont and the Marion County Commission. Visit us 24 hours a day on the web at this address and visit us for monthly listings at our blog site. Visit us on Facebook, TV 19 Fairmont, and also at the J. Harper Meredith Building, 200 Jackson Street, room 102. For our schedule, call 304-366-4511 or email us. We invite your tax-deductible contributions to the Greater Fairmont Council of Churches. You can mail those to P.O. Box 847, Fairmont, West Virginia 26554. So until we meet again, this is Dee Dee Mann saying so long, take care, and be a blessing.